We are Worldview Wellness. We'd like to thank you for joining us. This is Health Matters, episode 6.
6?
Today is 6.
All right. Good job.
I know, 6 weeks in a row.
Yay for us.
Yay! Go us. Today we're going to be talking about informed consent, which I think is really, really important. Probably has become one of the more important things that we do in our business.
Yeah, absolutely.
I didn't expect that, but it has been. And I'm just going to kind of let you explain to us what informed consent is, why we give informed consent to our clients, even when they're engaging in therapies that have nothing to do with us, which would be chemotherapy, radiation, any other modality that standard of care medicine has requested that they go through. We can give them informed consent for that.
Yep, absolutely.
So tell us about informed consent. What is it? Why do we need it? What do we need to know about it?
Well, I think, I think informed consent really, as far as just a principle in medicine, is probably one of the most important things for the situation that we find ourselves in now, especially after the last, several years of, COVID and failed policies surrounding COVID.
No joke.
The concept of informed consent actually, is a relatively new concept. There was for hundreds, if not thousands, of years, the concept of the doctor in the scope of treating their patients was not to give informed consent, because they used things like placebos and other things. And if you have somebody that is truly looking out for you in your best interest, then certainly the use of placebos can be a very beneficial thing, because a placebo, by definition, is something that really doesn't have any, biological activity in the body. So it really severely limits, any negative consequences of taking something, like side effects, which every single pharmaceutical that's available, whether it's a prescription drug or over the counter, they all have a whole plethora of different side effects that can range from anything just from poor nutrient absorption all the way up to things like cancer with some of the newer drugs that are monoclonal antibodies or immunosuppressants. And so in that context, what we've kind of been through in the last 3 years, especially around the drugs and so-called vaccines surrounding the COVID-19 situation that we have found ourselves in, has basically been to take away the whole principle of informed consent. And we're still fighting that because, as the name implies, a prerequisite of being able to give consent in that setting is the information. You have to be able to weigh the information to be able to make a decision. And Ty, we were just talking before the podcast about one of our clients who may have gotten a COVID vaccine series of the injections without giving consent or without being informed, and so that just kind of goes to highlight the problem that we face.
I kind of want to clarify this, because I think that a lot of people run into this at the doctor's office, and we willingly have learned to accept it.
Mm-hmm.
I believe that our client, before they came into our service, I believe this was over a year ago, I believe that this client was probably at his doctor's office. The doctor said, hey, we need to get you caught up with your vaccinations. The client probably said yes. And then the COVID vaccination was administered not just once. They were given a follow-up booster later without the knowledge of what they were taking. He does not remember signing a consent form for this. He did not receive informed consent.
Right.
And now he's had 2 jabs without informed consent. And he's in a pretty serious place, and we don't know what we can attribute that to at this time, but there could be some serious implications.
Well, so, kind of go back and talk about, what is informed consent, and, how might we apply it to that situation. Well, the principle of informed consent is absolutely critical for any of us to determine, as far as our wishes as to what happens to our bodies. It's our right to be able to guide therapies, treatments, or to make a decision to engage in a treatment or to not engage in a treatment based on our own moral code, our own conscience, and that doesn't necessarily need to rely on on any spiritual practice or religion or anything else. But it is essential that we have a foundational appreciation that we are free and sovereign individuals, and we have the right to determine the things that we apply to our bodies, and to have our own integrity and bodily autonomy in the decisions that we make. And we have the rights to say, this is your conventional medical treatment, and I don't agree with the principle of that, and I do not want to pursue that. I want to pursue something that I feel more comfortable with, that is something that I can live with, that my conscience can live with.
What I have found to be true for many, many people, and this was for myself as well, before you and I ever met, I would go to the doctor. He would tell me what was wrong. I would take whatever he prescribed. It never dawned on me to question, to ask what the pros and cons were of this medication. It was never offered to me, informed consent.
Right.
And I do think that we have fallen into such a malaise of allowing other people to take care of us, even when we don't know what that involves, because it's easy. Take this pill, you'll get better. Okay, I don't have to read. I don't have to spend hours doing research. I don't have to invest in something that takes a lot of time,
Right.
a lot of education, and a lot of study.
Well, there's so much nuance around that topic.
Yeah.
And this is really like, once you start considering, issues of conscience and morality, and you really need to get into the philosophy and understand and appreciate the nuance of kind of where we find ourselves today.
Well, it takes work to be free, right?
It
Because we
absolutely
have to
does.
know our freedoms in
Yep.
order to be free, and in order to not only stand on that hill, but understand
Yeah.
our right to stand on that hill.
Yeah. One of the things that I have kind of come to appreciate over the last few years is that freedom is dangerous, and freedom requires hard work, because freedom requires that you are independent. And just to kind of unpack that statement a little bit, if you think about the modern person in our country, and you would, the concept of independence is kind of a superficial concept these
Right.
days, the way most people understand it. But let's just talk about the average person walking around in America thinking that they're independent, but they have a car payment. They have a mortgage payment. They shop at a grocery store for their food. They have to go to the gas station for their gas for their car.
They have prescription medications they have to take.
all of the prescription medications and everything. And
Right.
so, especially coming at it from the health perspective, basically we would say all of those things are, making you dependent on a certain thing, right? And the more that you are dependent on things, two things. On one side, it's convenient. It's a lot easier to go to the store and buy your produce at the store, out of the organic section, hopefully, but then to put a garden in your backyard and do that work so
One
that
thing
you can
that-
feed yourself.
Yes, and one thing that keeps popping into my mind is being free can be exhausting.
Yeah.
It takes work to be free. But what did Benjamin Franklin say about freedom?
Put me on the spot here. I think that the quote is, "Those who desire." Let's see, what is it? Oh my goodness. Those who desire safety over freedom deserve neither.
That's right.
Something to that effect.
Right.
I probably butchered that quote, but it is something to that effect.
Well, the premise is basically, if you are unwilling to earn and fight and keep your sovereignty as a human being and your freedom, someone will take it. Something will come in and fill the void, like it always does, and you will lose your freedom.
Well, the modern safetyism, that's becoming kind of a more frequently used term, among academics, more probably on the conservative side of things. But the modern Western culture is basically being steered by creating boogeymen and making people feel scared and afraid, and then offering the solution to make all of us safe.
Isn't that convenient?
And I've noticed, especially in the last year, when we're talking with people or whatever, it's very common to hear someone say, to say, "Oh, well, be safe." All right, see you later. Be safe. And, it's like, where did that come from? We didn't used to say that. That used to, that wasn't, not that we didn't want people to be safe, but, there's such, this intense, focus on safety now, and everybody has to be safe. And, when you really get down into the philosophy of freedom and liberty, it's dangerous. It's the opposite of that, when you're responsible for your own health, well-being, safety, that is inherently dangerous. But ultimately, we are our own principal advocate. And if we can't do that for ourselves, then, we are the ones who are most equipped to do it for ourselves. The second we outsource any of that, you're going to make sacrifices and compromise.
I love that you use the word outsource, because that's exactly what happens with medicine. You're outsourcing your health to someone else, and you're trusting that they have your utmost well-being in mind and that they will first do no harm. But that's not always the case.
Yeah.
And, erring on the side of allowing someone else to take over your thought process, to not research what they've asked you to do, to not be involved in your own process, can lead to even more safety risks and deeper implications down the road than what we can possibly imagine.
Yeah, absolutely.
Explain to us what informed consent is. When did it start?
Well, so informed consent, if you look at the Merriam-Webster's dictionary, informed consent, the legal definition, they actually have two separate definitions. One of them is the legal definition. And so the legal definition, which is the one we're going to pay attention to today, is defined as consent to medical treatment by a patient or to participation in a medical experiment by a subject after achieving an understanding of what is involved and especially of the risks. So in the United States, we have a commission called the Joint Commission. That's a nonprofit medical accreditation organization, and it requires documentation of informed consent. And, in their specific verbiage, they require documentation of all the elements of informed consent in a form, progress note, or elsewhere in the record. And then they specify 5 individual components of informed consent. And those 5 components would be that you have to be aware of the nature of the procedure or intervention. The second component is you have to be aware or made aware of the risks and benefits of the procedure or intervention. Number 3 is you have to be informed of reasonable alternatives. Number 4 is you have to be made aware of the risks and benefits of the alternatives. And then finally, you actually, according to the Joint Commission, there should be some sort of review to ensure that you as the patient are, have the capability to understand all of those things.
So hold up. So what you're telling me is that a verbal yes is not enough to express informed consent.
Well, let's go back through what the Joint Commission requires in the specific instance of this particular client of ours. So assuming that, and we don't have any records of this. We're looking into it, but we're going to assume that there was a verbal, hey, we want you to get this vaccine. And we're going to go ahead and assume, for the sake of argument, that the answer was yes. So if that was the case, then the first element required by the Joint Commission in informed consent is the nature. You have to be informed of the nature of the procedure. So we could say in that particular instance, assuming that the doctor said or a nurse said, hey, it's time for you to get your COVID shot. So the nature of the procedure, you could probably make a legal argument for the fact that, he understood that it was going to be an injection, that it was going to be a vaccine. So we could say, okay, maybe you pass number 1. However, we get to number 2 and everything falls apart. So number 2 is that the risks and benefits of the procedure should be given to the patient. And in this particular case, with the assumptions that we have made, without evidence to the contrary, is no explanation of risks or benefits.
None.
I mean, you could maybe make an argument for, well, there was an implied benefit, which is why the doctor or the nurse was telling me I should get this. But outside of that, there was nothing.
Well, not only that, but this person's spouse had no clue that they had gotten 2 COVID jabs up to this point.
Right.
No one knew.
And they didn't know either.
Right.
Now, that doesn't mean that at the time they weren't aware of it. But, at the end of the day, one of the things that I would tell you from a year ago is part of the risks, especially with the COVID jab, is that we don't know what the risks are.
Right.
Some of that is because it's a very new technology that hasn't been around for very long, although there is a whole plethora of evidence based on prior research in the mRNA vaccine technology that there's a ton of risks.
Boy, is there.
To cardiovascular disease, to autoimmune disease, to cancer, to all kinds of different things. And so on one hand, you could say that, well, in order to be truly given informed consent on that, part of that explanation would be there's a lot of things that could potentially happen that we aren't aware of. Mm-hmm. The other side of that explanation of risks and benefits, or specifically risks, are that the information has not been widely distributed and publicized. So, for instance, a lot of what the pharmaceutical companies, as far as their studies are concerned, they have not been forthcoming with the actual data. And what's been published in the medical journals to a large degree has been, a whitewashed version of the actual science that doesn't really reflect what they found. For instance, I see billboards in our town. Go downtown and I see billboards of, if you're pregnant, you should go get your COVID-19 vaccine. Well, guess what? How many of those women who are going in based on that billboard are going in there, and how many of them know that there have been no studies on the vaccine in pregnant women?
Very few to none.
None. There have been no studies.
And if they knew that many miscarriages resulted almost immediately after this vaccination, would they rethink it?
Yeah. Well, the literature and the anecdotal evidence that's out there right now, basically, from that perspective, it looks like the miscarriage rate's going up, late-term spontaneous abortions are going up, infertility is going up, adverse outcomes with regards to abnormal menstruation and bleeding and all of that type of thing in women. All of those reports have dramatically skyrocketed since the introduction of the COVID vaccine. That did not pick up until the vaccine. So you cannot blame this on COVID.
Right. And it could be that if some of the people who have experienced the adverse side effects of this gene therapy knew and had informed consent, it could be that they would have made a better choice for themselves and their unborn children.
Absolutely. And so this problem is deep. Like I said, we need to talk about the nuance here. So you could say, well, this doctor, we'll just say for the sake of the argument today that it was a doctor that said, hey, you need to get this vaccine. When we get to step 3, discussing reasonable alternatives, well, guess what? If you're a conventional doctor that just reads the conventional medical literature, it's very likely that you have read that things like ivermectin, vitamin C, hydroxychloroquine, there's a whole slew of off-label drugs that have, come out after lots of literature review by the frontline doctors. These are alternatives, but in the medical literature, doctors have been told that these are not alternatives, and that there aren't any alternatives. That this is the only way to treat this, which is absolutely not true, and that's demonstrable in the medical literature if you can get outside of the purview of the major medical journals.
Okay.
So, is that the doctor's fault? And I would make an argument of no, that's not the doctor's fault. That is basically a systemic failure of the medical system at large.
In my opinion, I think it's both the doctor and the patient's fault. It is our job to find out what people are pouring inside of our life vessel, our body.
Yeah, and I can certainly understand that argument, and I think that at the end of the day, I see things that way for myself personally. I don't think that I would be very much of a help to our clients if I wasn't going out there and doing my own independent research, because I understand how corrupted and broken the medical system is, especially after 3 years of COVID now. And so even though I made an effort to prior to COVID, it's even more important to me now because it's just so much more apparent at how broken the system is. And so I'm the buck stops here.
Right. The buck stops with you.
Yeah.
I would say that if a doctor is not giving informed consent, that it's also, the responsibility lies with him. But having said that, the medical system is so broken. Doctors are many times seeing anywhere from 30 to 50 patients a day. If they can handle that kind of load, and it doesn't seem to be getting any easier for them. They spend less time with their patients.
Yeah.
And so I can see how easy it would be to allow something like that to fall by the wayside and to just breeze through giving somebody a medication and just walking away, not giving informed consent. So it's so important that we advocate for ourselves. When we have children, we advocate for them.
That's right.
Or do we, when it comes to medical intervention?
That's a whole nother podcast.
That's a whole nother podcast. So let's go on. Talk to me about the Nuremberg trials.
Well, that's kind of where the intense focus on informed consent really started. So for those of you that aren't aware of the Nuremberg trials, those were international court proceedings that followed World War II after it was found out, the atrocities that happened in Nazi Germany. Part of those trials were, I want to say they were in 1947, maybe 1948. But there was a whole individual set of trials that were done specifically for the doctor. So the big famous doctor from Nazi Germany was Dr. Mengele, who did horrific experiments on the Jews and the other people who were, basically in that eugenics program, who were in the concentration camps, and just butchered people. I don't even want to go into all the different specifics of that.
Right. The experiments he did on children was
but it
unparalleled.
it was experimentation on an individual without any consent.
That's right.
So there was no information, there was no consent, and so basically it was found to be a crime against humanity. And in the aftermath of the Nuremberg trials, due to the crimes against humanity, informed consent kind of emerged as a principle. And it was then also likewise discussed in the Declarations of Geneva in 1948 and the Declarations of Helsinki, later in 1964. Of course, those have been revised multiple times, but the basic principle in a lot of those declarations and in the Nuremberg Code is informed consent. And it basically is to protect against crimes against humanity, that, to allow people their own sovereignty and their own bodily autonomy to be able to say yes or no to a proposed medical treatment, medication, experiment, anything that could, potentially cause harm. And so that's really where it came from. Was from, the atrocities that happened during World War II. Of course, there's been situations in our own country, like the Milner experiment, and the Stanford prison experiment, where they're looking at different aspects of that, but really kind of exploring the human nature of how all of that kind of stuff goes together and whatnot. But the basic principle and the thing that we believe in wholeheartedly at Worldview Wellness is the fact that people should have the right to what we call, or what we tell people is that you're the captain of your ship. You drive the boat, And our job is to give you what are your options, what do we think is in your best interest, what are the risks and benefit of those things, what are some of the things in the conventional world that might be offered to you, what are the risks and benefit of those things, and then having just a fact-finding mission conversation to make someone feel comfortable about starting to make that decision for themselves.
But then leaving the final decision up to them as an autonomous, sovereign human being.
And that can be really stressful for people because, there's lots of people, because of the indoctrination that we have in our culture, to, oh, I have to make this decision.
They want a hard
that means
yes.
I'm responsible.
Yes, absolutely. They want a hard yes or a hard no. They want someone else to guide them and tell them what to do. We will guide our clients, but we're not going to tell them what to do. We will inform them.
Yeah.
We will give them our opinion. But in the end, our goal is to educate in such a way that they can come to an informed decision on their own, whether it's what we agree with or not.
Well, and, it comes up quite frequently. Someone wants a hard answer of, what do I do? And so sometimes the way that I get around that is I'll say, well, this is what I would do if it were me. Or this is what I would do if my wife were in a similar situation. Or if my dad were in a similar situation, this is what I would recommend. Or this is what I would do. And I think in the conventional world, a lot of conventional doctors kind of get, pigeonholed into situations where what they're almost required to do, because it is the what is colloquially referred to as the standard of care. That's not necessarily what they would do if it were themselves.
Do you mind if I tell a little bit about the story of you wanting to give informed consent when you worked in the standard of care practice that you worked in years ago?
No, that's a great topic to go over.
Yeah, so you started really questioning this need to speed patients through the rooms and not give them informed consent. And you've always been really big on really getting to know your patients, really creating a healthy dialogue and creating a bond of trust between you and your patient. And so you began to give informed consent when it came to vaccinations.
Well, that was specific, how this whole thing first got started. It was specific to the flu vaccine.
Okay.
So, I had done a bunch of research, independently of what was coming out through our hospital chain and guidance from the CDC and all of that. And I was looking at safety, efficacy rates for the flu shot. And I was surprised to find out that the efficacy for the flu shots are horrible, abysmal. Even Fauci has recently come out and said that, very recently, in just the last few weeks, that the it's a shame that the efficacy of the flu shot wasn't better. He's also come out and said that about the COVID vaccine now. But to address the actual point here, the efficacy rates weren't there. The efficacy rates in some years of the flu shots were as low as 9% efficacy. And then on the other side of that, so not effective. So what are we told to expect out of medication? Safe and effective. So the efficacy for the flu shot wasn't there. At least not consistently.
Right.
The other part of this about it being safe, I pulled out the product insert and started going through the numbers that they had as far as the safety data. And one of the things that kind of popped out at me was there was a quote, and this is actually in the the PI of the flu shot, or the product insert for the flu shot. It said that on subsequent years to flu shots, your antibody responses will diminish. And that may not be word for word. That's probably a paraphrase, but ultimately the takeaway was when you get these flu shots, especially if you get them serially, every year, like we're told that we're supposed to do, you're going to have decreasing antibody responses to the flu shots, which, the interpretation of that is it is going to do something to, harm your immune system. And so you might get, if we were going to give the pharmaceutical industry the benefit of the doubt, you might be able to say, that the flu will diminish your, chances of actually getting the flu, which I don't even think that the data really pans that out very, very much. But if you were going to be a pharmaceutical executive and try to argue that case, then you'd probably say, well, there's enough efficacy to to warrant that. But then when you start looking at the harm to the immune system, for the amount of efficacy that is reported by the CDC even, and those numbers, in my opinion, are probably pretty significantly manipulated if anything that's happened in the modern era, correlates to that. But, so not safe, not effective.
Well, so you got a lot of kickback from your the physician who was running the clinic, and
Yeah.
when he found out that you were giving informed consent, he basically told you that you can do whatever you want with your own family, live however you want, but that you're not going to do that to his patients. And then
Right.
you guys went back and forth over that, about the legalities of informed consent,
Yeah.
and then rather than allowing the headbutting to continue, this particular physician literally took the power away from you and began circumventing the patients who needed vaccinations straight to the nurse instead of
Right.
running them through you.
So yeah, kind of how that went down was that was the first battle, I think. And so how that went down was, he said, well, my response to him was, I'm going to give my patients informed consent. And he and the director over our division of the hospital basically got together with me and said, okay, well, so if someone's coming in just for a flu shot, then they don't get to see you anymore. Unless they ask for you or unless they're your patient. If they're just coming in for a flu shot, they don't get to see you anymore. They're just going to, sit down with the nurse, and the nurse is going to, give them the little sheet of paper and jab them.
Yeah, the nurse is going to what? She's
Right.
going to give them informed consent?
So, and so there were real risks, right? That people were not being informed of when it comes to the flu vaccine. And my, job as a medical provider, the way I saw it back then and the way that I still continue to see it is that, I think that, especially considering that every medical intervention potentially can carry a risk, it's important that people are aware of that so that they can make the decision to decide if the risk-benefit analysis is something that they're comfortable with.
Well, that was literally one of the last nails in the coffin for you. I remember you were
Yeah.
so frustrated
In
with the
conventional
standard.
medicine, for
yes. And
Well,
so
and
that's when we started looking for
So that
something
was
else.
that was the first battle, though.
Yeah.
You remember the second battle?
Uh-uh.
So the second battle was they wanted me to take the flu shot.
Oh, that's right. And then they commanded
Right.
you to wear your mask
Yeah.
to the clinic every day.
So they told me that I was going to need to take the flu shot, and I told them that I wasn't going to take it. And then they, we scheduled a meeting again.
I'd forgotten
And
about
I
this.
said, so I'm sitting down with my supervising physician and the hospital director, and they said, essentially, well, we're going to either need you to take the flu shot, or if you don't want to take the flu shot, that's fine. You're going to have to wear a mask in the clinic. And I said, there's been a whole plethora of data on, masking to prevent the spread of aerosolized viral particles like COVID, like influenza. And all of the data has come back showing that there's no effect from wearing masks.
Goodness
so
me.
I'm not going to wear a mask either.
You were a heartburn clinician for them.
Well, and even the Cochrane review, they did a review, and this is prior to 2020, obviously, considerably. But the Cochrane review had already done a review of all of the literature, back then, and I had that documented, and I had that in a folder that nobody wanted to go over with me. But it basically showed that meta-analysis of the data reveals that there's no evidence that masks help reduce spread or transmission of aerosolized viral particles.
That's the first time that we literally saw people who claimed to be a part of the scientific community turn their head and shun where the science would take them, and to literally
Right.
scream from the rooftop that truth is not the truth.
Right. Well, and so, they did not want to go through any of my data. They basically just told me after I brought that to their attention that the data wasn't important, that was the company policy. And so I looked at them in the face and said, you will have to fire me. Because I knew that if they fired me over that, and if I had data on my side, that I at least had a reasonable chance to win a case for wrongful termination. Because ultimately, the way that I was looking at that was, you're going to use a humiliation tactic to further the propaganda of the flu vaccine and what we need to do and all that. So it really was not based in any kind of scientific basis. It was a complete propaganda, example of psychological warfare, where they were wanting me to do this thing that I knew was completely ridiculous, just so that I can show them that I was a subservient employee of theirs, and I was not willing to do that because it didn't. That was not what my conscience was then, and it certainly isn't what it is now.
Well, something I want to say to that point is that you researched yourself and went through the data yourself. You poured over all of this information yourself and came to the conclusion about your own health yourself. And something that I want to say to our listeners now is you are smart enough to do this.
Yeah.
You are smart enough to learn about your own body. You're smart enough to read data samples. You're smart enough to read studies. You are smart enough to do this.
And that's also what we're here to do.
That's right.
If you go back and look at, the original interpretations of, the ancient, like, Greek and Hebrew words for doctor, a lot of them are interpreted as teacher.
I didn't know that.
And so, doctors were seen as teachers and educators. They're teaching people how to eat right. They're teaching people how to, how to move, and just, telling people through lifestyles. I mean, if you think about it, 2,000 years ago, there was no aspirin.
Right.
There was no, atorvastatin.
Right.
The pharmaceutical industry was essentially non-existent, and so what they had to work with was lifestyle. And herbs
and nature that God created,
right.
Yes, absolutely.
And fasting, and
yes.
Things that that could promote healing in and of their own body and through nature.
And boy, wasn't Hippocrates a genius?
Absolutely.
Let food be thy medicine, and thy medicine be thy food. It's brilliant.
So you fast forward how medicine works today, and almost no. We talk an awful lot, and we talk a mean game about, prevention. But are we really preventing? Is getting a colonoscopy preventing colon cancer? Is getting a mammogram preventing breast cancer? That's not prevention. That's surveillance.
Right.
Prevention is, let's have an honest discussion about how broken the food system is in our country or in the world at large.
And then let's take responsibility for what we put in our own mouth and how we choose to live our lives.
Let's have a conversation about how sedentary people are.
Yeah. Smoking.
Let's have a conversation about about the iatrogenic death rate in our country or in westernized countries.
Explain what that is.
So iatrogenic death is death caused by some form of medicine. So that could be, a surgical accident. That could be you were taking too many medications and expired from side effects from the medications. That could be, an improperly prescribed medication, a medication prescribed at the wrong time for the wrong indication that ends up, causing a death. Well, there are some people who have, made, done very detailed statistical analyses of the, deaths in our country, and said that it could be as high as the number third cause of death that beats out cancer. There are other people who've done statistical analyses and found that it's a possibility that it could even be the number one cause of death in our country.
I wouldn't be surprised.
And, of course, the skeptics out there and the, quack watch people and all that would, they argue about how the way that these studies done were not right and all that kind of stuff. But they really, what I feel comfortable saying is that the iatrogenic death rate in our country is much higher than it should be.
Right.
And I would say that the iatrogenic death rate in our country, based on the evidence that I've seen, is likely to be at least the number third cause of death.
We had this discussion.
And certainly now after 3 years of COVID and the vaccine.
Of course. We had this discussion, I guess, about 2 or 3 months ago, and I couldn't believe it. I couldn't believe it. That shocked me.
Yeah.
Wow. Well, let's continue. Talk to me about the Great Barrington Declaration.
So, I wanted to touch on this briefly, just because it speaks to the component of informed consent about the nature of the procedure and the risks and benefits of the procedure. Those being the COVID vaccines. I hate talking about COVID anymore, but I think that it's just so important. Even though the majority of our clients are cancer patients, but we deal with wellness issues as well, and
Right.
other complex chronic illnesses. But looking at it from my perspective in helping with cancer, one of the side effects from the COVID-19 vaccines seemed to be a huge spike in the cancer rates. New diagnoses of cancer, recurrences of cancer,
Yep.
making cancers that are already present more aggressive. Those are things that oncologists all over the world are observing and seeing. And it certainly seems, when you look at the timeline and you look at the epidemiology of this, it certainly points a finger at the COVID vaccine. Now, because science is in the state that it is, of course, we can't say that definitively, but we can definitely say, hey, there seems to be a correlation here, and I want to be really careful, because correlation does not equal causation. So we can't say definitively that, yes, that is what has caused it, although it certainly appears that is at the very top of the list as far as what is doing that. But so the Great Barrington Declaration speaks to those first two elements of informed consent, because they basically, let me tell you what it is. The Great Barrington Declaration came out pretty much in the very beginning of COVID, and it to this day it is a declaration that basically talks about how we need to really apply a truly scientifically informed application of any of the protocols or any of the ways that we are responding to COVID-19. And so, based on the data that we had way back in the very beginning of COVID, we knew that the masks didn't work. We had decades of and multiple studies to show that masks didn't work.
And when you started to produce that information with literature, we got such an incredible pushback from people out of fear.
Right.
And now it has turned out to be exactly true.
Right. Well, so there's that. There's also the data, or rather absence of data, to support any kind of lockdown. And, certainly no data, essentially no data on the risks and benefits of the vaccine. Of course, we were told that they were safe and effective. But people who were thinking for themselves from the very beginning knew that there's no way that you can claim these things are safe. It's impossible. You cannot claim that they are safe, because the typical vaccine goes through anywhere from 5 to 15 years of clinical research before it starts ending up in people's arms.
Well, and not only that, but what's the uptick in VIRS now? I mean,
oh, it's atrocious.
Yeah.
But
So
we're not talking about now. We're
Okay,
talking
right.
about back then.
Right,
So,
right.
when you start to look at, okay, the risks and benefits of the procedure, something we went to a dinner party last night, and something that came up during the dinner party was the fact that the product insert. I was talking earlier about the product insert
Right.
for the flu shot.
I was hoping you'd bring this up.
Well, the product insert for the COVID, shot, the experimental use authorization COVID shots that everybody got. When you open up the product insert on that, guess what? It was blank. There was no data on it. And so, how can you provide informed consent to somebody when you have none of the data?
That is criminal.
It is. Yeah.
And every time I hear that, I become incensed. It is criminal.
So basically, the Great Barrington Declaration, they actually created that, and made a petition to go along with it to, see how many people would, agree with that and sign on to it. And although there is hard data now that shows that Google, and a lot of the big tech companies actively censored the Great Barrington Declaration. There is FOIA request information that's come out that shows that Fauci himself, along with Birx and Redfield, or the people that are in the top levels of the health bureaucracy of our government were actually seeking to discredit people who had come up with the Barrington Declaration and censor them. So it was highly censored on, in the media. It didn't get brought up in the, in the mainstream media at all. And if you did a search for it, in that entire first page or two of search results, all you would get is, articles from, different conventional media sources that were bad mouthing the Great Barrington Declaration. But to date, there are almost 1 million signatures. I think it's over 930,000 signatures, including, give or take, 873,000 concerned citizens have signed it. About 47,500 medical practitioners have signed on to agree with the principles in that. And, probably most importantly, 16,000 medical and public health scientists. And basically the principles of the Great Barrington Declaration is we need to follow the actual science, not a narrative. And we need to, appreciate that there's a great difference between how this affects different demographic groups.
Right.
Almost essentially a 0% chance for young children to have any kind of complicated, outcome with COVID, including death. And, when you get into that older group of, people that are alive now, of course, the risk goes up quite exponentially. So basically what they were saying is we need to take a look at actually what we're seeing here. We need to, protect, the people that are at the highest risk. And we need to allow the components of society that are at low risk continue to live their normal lives. We do not need to mask because there's no data to support masking. We do not need to lock down because there's no evidence to support lockdowns. And the concern of them at the time, and you keep in mind, this is close to 3 years ago now, the concern of them at the time is basically what we have seen come to fruition in our culture, which is that there has been a dramatic increase in the death rate. Mm-hmm. There has been innumerable harms to our children through lack of socialization because of the masking and the lockdowns, and the neurological development of our children. Suicide rates going up.
Right. Domestic violence
rates
300%,
going up. Anxiety and depression rates going up.
Yes.
I mean, so the cost of the governmental response to COVID was worse than COVID.
Yes, it was.
And the fear and the propaganda that was peddled basically led people into that fear response, which then made them want to make decisions to keep themselves safe. But essentially all of the data that they were looking at was a lie. We were looking at case rates. We were testing with PCR that doesn't test for infection. I can't even begin to tell you how frustrating it was for me as a clinician who was practicing in a clinic at the time to see the amount of people that were coming in that were completely asymptomatic, but because of all of the fear and the propaganda on the in the news, they went and got a COVID test and they were positive. And it's really difficult for people to understand how PCR tests, which is the most common form of test for COVID, can't diagnose infection.
Right.
And even the person who came up with that technology, that polymerase chain reaction technology, said you can't use this test to diagnose an infection. And that's, especially when you run those tests at high cycle rates, mm-hmm. which is what we were doing. And so there were a lot of, false positives. And there were a lot of people going out and getting tested even though they were completely asymptomatic. Mm-hmm. And just the amount of fear, if you were under, I think that the data is if you were under 70, then you literally had a less than 1% chance of dying from COVID. Mm-hmm. And you look at all of the, the death and the, economic hardship and the changes to our society that have occurred because of the last 3 years of failed policies. And, no part of that has anything to do with informed consent. And so that was a big part of, kind of the failure of our medical establishment, and it continues to be a big part of why the medical industry at large has become, well, dysfunctional. So
Yeah. Man, what a last couple of years we've had.
yeah, it's been very stressful.
Incalculable harm. Did I say that right? Incalculable.
I think you said it right the first time.
The harm to our children. And when you were talking about the group of individuals who are at the highest risk during COVID, in my opinion, as a mom and as a grandmother, it was to our children.
Yeah.
It was to our children. They were at the most
Yeah.
risk because people were uninformed, people were scared, people were thrown into PTSD, and didn't really have a healthy, productive
Right.
way of seeing straight through it.
Well, and I mean, you could even talk about this on a deeper level, of, more society-based level. Here recently, I've begun seeing articles, typically in left-wing journals, but these articles are essentially written by people that are casting the blame for the failed COVID policies on people like me and you,
Who are unvaccinated.
who didn't get the vaccine.
Yeah.
And the titles of the article are things like, why didn't you warn us, or basically casting the blame at our feet, with very little and really no attention to the fact that there are a lot of us that not only did we speak up, but we were ridiculed, we were persecuted, we lost jobs, we had our licenses threatened, we were completely censored on any version of the public square via social media, via news outlets. So in that context, if you're going back to informed consent, there is really, the scale of it is on the society level, because our society censored, the people who are in power, who have the ability to control things, like who and what gets censored, especially now that we're in the age of the internet, that's really the most important forum. But the people who have the ability to do that, so we're talking about like the YouTube algorithms and the Google algorithms and all of the different AIs that are in charge of, at the, input of the people who own them, are in charge of how that data gets shared and manipulated, had a narrative that those of us who were dissenting on the narrative, even though that's how science works, that whole dissenting narrative was completely eliminated. So back to the concept of informed consent. How are you supposed to be informed when all of the dissenting opinions are being censored?
Not only that,
you can't.
Right.
It's impossible.
We were, our society was virtually held prisoner if you didn't do what you were told.
Yeah.
That still blows my mind.
Right.
The length and the breadth of it still blows my mind.
Well, and so, I mean, all of these concepts, I mean, the reason that we're talking so much about COVID and about, the current medical model and all of those types of things are just because it's really important for people to hear, all of this nuance, to come to the conclusion, of how involved they want to be, in their personal health. How independent do you want to be in your health? That's why we started our business and are doing it the way that we're doing it, is to be as independent as possible.
Yes.
And we encourage our clients to be as independent as possible. And I take my role very seriously, and and I really think that one of my strongest qualities is as a teacher, as an educator. And I have a passion for informing people about what their choices are, and I'd be lying to you if I said I know everything. I certainly don't, and I'd be the first one to admit that. So I may not give every single alternative to a particular medical intervention, but I give. I would put myself up against most people in medicine and say that I'm aware of a lot of the current, ways and alternatives to certain medical things, and I certainly try to give full informed consent about that when people are trying to come to the conclusion that makes them feel the most comfortable.
Right.
It's just getting them to the to the point where they understand that it's their decision, it's not mine.
Absolutely. Well, if you're listening, we'd love to help you guide your health. We would love to teach you. We would love to educate you. We would love for you to reach out to us and let us help you with your wellness needs and taking you to that optimal place in the higher ground of health. And today was good. I really appreciated this conversation.
Yeah, it's an important one. It's probably, I would make a good case for it's the most important conversation specifically about medicine of our time.
I absolutely believe that. I have really come to the understanding that that is one of the strongest points. Well, I love what we do. Mm-hmm. I love what we do, but that really is one of the strongest points that we stand on and try to give our clients the very best information that we possibly can. And you do a great job with that. I love listening to you empower our clients and help them understand their rights, their freedoms, mm-hmm. the questions to ask, the buzzwords they need to use in order to get the right information from their doctor. And I think, as you do, it's one of the most important things that we can teach people.
Well, and I think I will end with a quote.
Okay.
Those who are not aware of their history are doomed to repeat it.
Amen.
And when it comes to informed consent, I'll leave you with something to think about. The Nuremberg trials were about 80 years ago. And we have already come full circle into essentially a global experiment where nobody was given informed consent. And according to some researchers and medical providers familiar with a lot of the statistics and their analysis, the COVID rollout, just the vaccine component of it, by some estimates, has actually killed 13 million people. Oh. That doesn't talk about the increases in suicide, the increases, in deaths due to lockdown, the increases in death due to people not seeking medical care. Mm-hmm. Half of the people who had heart attacks or strokes during COVID didn't seek medical care in a timely manner and had poorer outcomes due to that. So, it is vitally important that we get the message out on informed consent, and for people to be aware of that, and for people to demand that their medical providers give them informed consent.
Great place to wrap it up. You can contact us at any time for light wellness needs to complex diagnosis. You can reach us at contact@worldviewwellness.com. Our website is worldviewwellness.com. And our phone number is 806-239-2559. Great discussion.
Yep. Thanks for joining us today. This has been Health Matters. I'm Micah Jackson.
I'm Ty, and be good to yourself. Get informed. Get informed consent for yourself and your children, because like Micah says, your health does matter.